Hello, this is Dr. Elmer, Advanced Neurospinal Solutions, and we have uncommon solutions to formerly unsolvable problems. I'm responding to a video that my patients have been seeing, and frankly, other people that I've talked to across the country. I have a doctor in Texas who brought it to my attention, and I told her I'd seen it. It's a video of a scoliosis surgery. I think it's very clever how they did it. They made it look very gentle as they bored holes, cut the patient open drastically and bored holes in the structure of the bone and put screws deep inside the bone as they put wires and then eventually cranked it into a straight position. And so what I think would have been funny if they would have put the actual sounds, the true sound effects, because it sounds more like carpentry as they're going and as they're boring these holes and cutting through bone, and then as they're cranking and how that cranking doesn't sound easy. It's going to be very harsh because it's going to take a lot to take this spiral staircase. And you remember, we talked about this before, scoliosis is not a lateral curve. It's a torsion or a spiral staircase. It's a helical type shape. And so they're taking this and they're beating it from the sides and cranking it and bringing it into that kind of posture, which is very interesting when you consider what the scoliosis is trying to do. The scoliosis is trying to get away from the pressure that is on it from the stretching of the cord, because it doesn't have the curves from the side, the neck, the mid-back, the lower back. And we learned this from Alf Breek, a neurosurgeon back in Sweden during the late 70s, early 80s. And he shows, literally in his work, Adverse Mechanical Tension in the Central Nervous System, he shows a picture of the distortion created. And this is the spinal cord. And on the inside of the curve, we're stretching it this way drastically, and then we're stretching it depth-wise forward and back on the other side of the curve, on the outside of the curve, drastically. Well, it's doing that because it was a full stretch beforehand because we didn't have the curves. We're stretching the cord all the way up into the pons, as he says. He calls it the pons cord tract. And so then we buckle and rotate, and so we create that to decrease the amount and drasticness of it, but it's still ugly. It still creates all kinds of problems, but it's not as bad as the full tethering of the cord. And so that's what it's trying to get away from. Now, if you can imagine that, I've got some illustrations here. Here is a torsional effect. This is the real issue in scoliosis. When we measure Cobb angle, that's not what we're measuring. We're not measuring how the spinous processes are rotated on the inside. You'll notice on this patient, the spinous processes, which are normally in the middle, here's one that's not quite in the middle. It's rotated, but these are all the way rotated on the inside, and that's that torsioning, that spiral staircasing. So imagine if this was the torsioning. Now we're going to straighten it like that. Now we're increasing the intensity of the torsioning. That is drastic on all the structures outside and inside of the spinal canal. And so you got muscles that are around the spine and they get torsion like that, and now they're fighting against that, and they're fighting against it all the time. These are reflexes that make those things happen. You can't think those muscles. They are a part of the extrapyramidal nervous system and the involuntary type 1 fast twitch or type 1 slow twitch postural muscle system, and they think you don't think them. And so they're getting torsion, and so they're fighting all the time, and they get stronger and stronger. And that's the reason why rods get broken. Because literally it's a constant gym for them to practice pulling against and eventually hopefully shearing that rod to give it some stinking relief from all of that torsioning. Imagine what's happening inside the cord, the torsioning and twisting inside the cord, which decreases the blood flow in the cord, according to Breed, which we've talked at length about what Outbreak has to say about that. That torsioning decreases the blood flow, which causes intermittent claudication. Also, it creates a constant torsioning on the breathing mechanism and the breathing system, and so they never will breathe very well after that. And we could just go on and on and on. But I got one final illustration that I think will make it a little bit more clear what we're talking about here. This is a rag, and we put it in water here, and we take it, and it's common to take a rag and twist it, and when we twist it, some of the water is going to come out of it. And so we twist it. Now, when we put it in that contraption and start to straighten it, it's causing it to torsion in a harsher way, but it also is going to stretch it. That is what's happening to your spinal cord for the rest of your life. And we wonder why there are so many issues after the scoliosis surgery, but 5, 10, 15, 20 years down the road. But hey, that surgeon's already retired and living in a castle in Belize, and the only option for a surgery is another surgery. So, but we have other ways to deal with it. In the Advanced Neurospinal Solutions, we do it through a series of weighting systems and molding systems to change the shape of the discs and to modify posture through the extrapyramidal nervous system and the type 1 slow twitch postural muscle fibers. And so with that in mind, we wanted to let you know that if you are a friend or suffering from scoliosis and are contemplating another option that has a much better outcome, we are here when you're ready to get your life back. Thank you very much.